Right now, more COVID restrictions being eased across the tri-state, with more schools dropping mask mandates. Tomorrow, New York State will drop its mandate in schools. New York City will likely follow suit Monday, according to the mayor, as long as cases don't spike this week. New Jersey is asking students to keep wearing masks on buses until next week, with some districts switching to masks optional now. That state lifting its mask mandate in schools March 7th. New information about Pfizer's vaccine today. It may not be as effective in younger kids. The New York State Department of Health found the vaccine's effectiveness in children 5 to 11 dropped from 68% to just 12% over a 2-week period in December. It's not clear right now exactly why. Researchers say kids under 12 receive only 1/3 of the dose size given to those 12 and up. And although coronavirus shots still provided protection during the Omicron wave, the shield of coverage was weaker than during other surges. That's according to new data from the CDC. The change resulted in much higher rates of infection, hospitalization, and death for fully vaccinated adults, and even for people who had received boosters. You certainly witnessed that. I'm Rich Barabi, in for Elizabeth Hashagen. Welcome to our live special report, The New Normal. Here with us today to break down all of these headlines and the changes for parents now, students, teachers as well, Dr. Sharon Nachman. She's an infectious disease specialist at Stony Brook Children's Hospital. Dr. Nachman, thank you for being here. Good to see you.
Good morning.
And remember, we always want to hear from you. So for the next half hour, we want to answer your questions. You can submit those questions to us right now on the live stream of this show on our Facebook pages. We will turn them around. We'll get them right to Dr. Nachman for a response. Okay, Dr. Nachman, let's start with the issue of masks in schools. These mandates are going away. Parents are going to have decisions to make. Is the time right now to remove the mandates in schools?
So I think we have to be cautious about mask mandates being removed. I think there are a lot of kids who did get Omicron, and that's perhaps some good news because we don't expect them to get COVID right away in the immediate future. However, there were a lot of kids that didn't have Omicron, and the concern is that they will now form a second little wave in schools. They were protected, they wore their masks, their parents were very cautious with them, and they didn't get exposed. Now, there is still some Omicron in our communities, even though it's less than 2%, there's still some cases out there. This is a highly transmissible virus, and for those kids who did not get it in the past, they are prime targets now to get it in school. So the word to the parents is be cautious. If your kid is in school and they come home with a respiratory virus, please test them for COVID. If they're positive, we do want them isolated.
Okay, so how about if your child is vaccinated in that circumstance then, whether or not that child has had the Omicron variant, would you feel comfortable as a parent with a vaccinated child saying, you know what, you can go to school without a mask on Wednesday?
I think those parents can be comfortable sending their kids to school. The focus of the vaccine was really not to prevent infection. It was to prevent disease. And I want to make sure people understand the difference between the two. Infection means you did get the virus. It was in your nose, you tolerated the infection, and you went about your business. Maybe you were home for a few days. Disease means you came to our emergency room, you were admitted to the hospital, or even into our ICUs. The vaccine was effective at preventing those illnesses. It was not effective at preventing you from getting a cold or your child from getting a cold. But then again, it was never meant to be that way. So I want to say if your child has been vaccinated, I think you're in this safe situation. In addition, the more important thing is that the vaccine prevented your child, even if they got COVID, from having MIS-C or that multi-system inflammatory illness. In fact, kids who got vaccinated didn't get MIS-C even after they had COVID. So we think that's really an important thing for parents to think about. If your kid has not had COVID, or even if they have had COVID, but they've not been vaccinated, now is a good time to get them vaccinated so we don't see them in the emergency room or in the hospital.
And yet, doctor, are you hearing a lot of parents say, I don't need to get my child vaccinated now, look at the numbers, they're all the way down, and so we survived this latest surge and it's not necessary?
So I wish I could have a crystal ball and say to you, guess what? We're not going to have another surge. But remember what happened in December. We were doing quite well. The Delta was going away. Everybody was kind of saying, okay, we're doing good. And then Omicron hit with a tidal wave against all of our children and families. We need to think that there's another variant out there, and it's going to come up and spring up on us without any warning. Because of that reason, I'd rather say take the preventive steps now, get your 2 doses of vaccine or 3 doses, as children might need their 3 doses, and maybe that will make a difference when the next variant hits. Thinking we're not going to see another variant, that's just not true. Most of the world is not vaccinated. That means variants can arise from any place around the globe. People are getting on airplanes. We are traveling to places. Those variants can come back in those airplanes and come to our neighborhoods right away.